Hi, everybody. This is Kay Denault with Mental Health Association of South Mississippi. I'm the director here of our center, and our organization is really a support type agency and working on advocacy and those kind of things for individuals who have mental health issues. And Liz Hoop is here. She is vice president of our board of directors. She was president before, has been on the board for several years, and we really appreciate all of her service and everything that she does for us. So Liz, thank you for being here.
Thank you.
Good deal. So let's start off. Tell us some things about yourself and what you do, on some of your background.
Well, let's see. I am a native Mississippian. I was born in Jackson, but I left Mississippi because I've lived in many states, simply because of education and things like that. So I moved back to Mississippi in 2007 from Houston, Texas, where I had lived for 25 years. Worked in big corporate America and had faced a layoff, and that after many years there, been laid off, and so I switched industries altogether and switched the type of career path I was on. I went from inside corporate America to outside sales and marketing type career, and that's currently the kind of role I'm playing at this point. I joined your Mental Health Association. I joined the board in 2015, but actually had volunteered with Mental Health Association at the Don't Worry, Be Happy fundraiser for several years prior to joining the board. So I am a mom. I do have one adult son and two very cute, handsome grandsons, of course. Any grandmother would say that. They are, well, this year they will be 7 and 13, so quite an age difference and personality differences, but a lot of fun when I do get to. They're in Texas, so I don't get to see them very often, but I do enjoy seeing them when I can. So,
Gosh, it sounds like you have a wonderful family. And I know you already had a passion for mental health when you came on board, so thank you very much for all that you've done for us. So right now, you work for a hospice organization, and you and I were just talking about how a lot of times people have a misconception of what hospice is. Can you explain to us more about your company, what you guys do, and what the differences between hospice and healthcare maybe?
okay. Home health. Well, I work for Solace Hospice, which we are a family-owned hospice company in Mississippi. Obviously, we're in Mississippi. We're licensed here. We provide in-home care for patients for hospice, as well as facilities. If they're in a facility somewhere, we can care for them in there. Our owner, or my owner, is like I said, we're family-owned. But my owner is also a combat veteran. He served 23 years in the Army. He said he went in at 17 to figure out what he wanted to be when he grew up. So he had a real love and a care for people, and that's what got him into this industry. That and the fact that his wife had worked for a family-owned hospice in Louisiana for about 15 years as a nurse. So that put the two together. He is a young person, but with a great passion for people. And that is the thing. People hear the word hospice and automatically think, oh my God, that person's dying, because so often that's what happens. They wait until it's too late to get hospice care. And what hospice truly is it is care for quality. So in other words, we are there to help with the quality of life a person may have left, whether it be 6 months, a year. We've had patients that, we've had for 2 years. Hospice doesn't mean that person's dying today or tomorrow. We're all dying at some point in time. But the terminally ill will eventually need extra care. And at a time like this, with this coronavirus that's going on, you can't run to the emergency room. You can't run to your doctor's offices and things like that we've normally done that's where hospice can come into play and be such a great asset, because we are 24/7, so the phones are always answered. A nurse can come to the patient wherever they are. You're not having to rush to an ER. You can call, get the nurse on the phone, and the nurse is making that house call just as if back in the Gunsmoke days of the doctor call on house call. The nurses come out, and so we do have care in the home, and we provide all kinds of resources for people who are at home during a time of illness, and we help with the caregiver, because so many caregivers burn out. We get tired. You know, you're not sleeping because your loved one's not sleeping, and you're afraid that something's going to happen if you fall asleep. And that's another area where we can help out with respite care. So I think that's something that is needed. I see it every day all over. I see people burning out, and they don't understand that I can get my mom or my dad or my aunt, uncle, brother, sister, whoever on hospice, and get the care that they need and the support that we need, and help us out here, especially during this time. And we are taking patients that are COVID patients. So if a patient has the virus and can go home, or is at home with it, and the diagnosis is not good, we can take care of those patients in the home, so they're not having to, stay in a hospital. Because if you're in a hospital, your loved ones can't be with you. It's still dangerous for them to be around you, but if you're taking the necessary precautions, like our nurses when they go in are masked, they're gloved, they're gowned. We're taking all those steps just like they would if they were in a hospital.
That's amazing, because you think about even just, I remember when my grandma started to get older and she was having difficulty standing up on her own. We couldn't lift her and those kind of things to help her get up and get to the restroom and things like that. And, just being in your home and having that comfort there, I would think that would be much more soothing and comforting than, being in the hospital setting.
Absolutely. Yeah, absolutely.
Well, that's a great service that you guys provide. And so is it Jackson County, Harrison? Where all do you guys go?
We are the 17 southern counties in South Mississippi. So think of us from the Alabama state line all the way across to the Louisiana state line, and then go north up around Hattiesburg, go east towards Laurel, and then come back down. So we're covering a large footprint with our services.
Wow, that's incredible. Thank you guys so much for all that you do. And I know right now it's the nurses and the medical staff, it's, I'm sure, a time that's causing some anxiety, just like everybody else. So you do some other volunteer work as well. What are some other organizations that you've been involved with?
Well, I currently serve on the board of Teen Challenge of Mississippi for Women. That is a faith-based rehab program for women ages 18 on up, and there is no limitation on the up side. I've seen women in the program at the age of 70, and I've seen the 18-year-olds. So it is based in Poplarville. They have 10 acres, and it's a nice facility there. It is faith-based. It is a 12-month program that the women can go into if they have a problem with drugs, alcohol, if it's a problem with some other types of addictions or issues. We can work with them and help them there to get rehabilitated. I also work with the South Mississippi Special Needs Organization. That's another one that's dear to my heart because I have a sister with Down syndrome, and Down syndromes tend to be a draw to me when I see somebody with that. It tends to draw you in. Very sweet. We organize events throughout the year for people in the Harrison, Jackson County areas. And we'll put on an event usually every other month. We had some things coming up we've had to cancel because of COVID, but that's another organization that I'm involved with and passionate with. And then another one I do is Adopted Grandparent Day program. That one I love because when I was in college in Missouri, I worked in a nursing home to help pay my way, and I would see people drop their loved one off at a nursing home and never come back and visit them. And there's so many people in these nursing homes that their family just or somebody just brings them there, leaves them, and they don't get visited. And it's depressing, for those people. They feel unloved and uncared for. So what Adopted Grandparent Day does is we gather volunteers. Last year at our event we had over 800 volunteers to go with us. Yeah, and we touched 35 nursing homes in the 6 counties in Mississippi: Harrison, Hancock, Pearl River, Jackson, George, and I'm forgetting the 6th one. But anyway, we touched those counties, and we went into those nursing homes, and we just spent an hour in there. The volunteers did activities with them. They drew pictures. They colored. They sang. Just different activities that they wanted to do is what we did with them. And we do that once a year, the day before Grandparent Day, every September. So that's another group that, it's another area that is, again, giving back and helping others, which is what my heart is people. Those 3 plus mental health are some of the organizations that I do help with. Mm-hmm. And then other things along the way as they come along.
Yeah. Oh, I know you're busy. You're a busy lady. Gosh, I've heard about the Grandparents' Day, and it just sounds like an amazing opportunity. So if people want to get involved in that, how do people get in touch with the organization?
They can actually go to our website, adoptedgrandparentday.org, and it has all the information there about volunteering. And if somebody wants to sponsor, there's sponsorship information. There's also contact information, so they can contact Kathy Rogers of Marston Rogers Group. She and her husband were the ones who had the vision for this and started this foundation. And so she's available to answer questions. So that's how to get to them.
Okay, very good. Thank you. I appreciate that, because I know when people hear about that, they'll probably want to make that step. So like you said, you've been involved with our Don't Worry, Be Happy event for quite some time. And, we're kind of in a figuring out stage, because our event this year is scheduled for Friday, July 17th. And of course, every week things are changing with our community. So we hope that we'll still be able to host that event. But of course, we're still working that out a little. But I just wonder, what do you feel is your favorite part of that evening?
It's all fun. I guess part of what I enjoy is seeing the honorees that we have, and watching as we try to get the in the live auction when we're auctioning their packages off, trying to watch them interact with the crowd and trying to raise those funds as best they can and get those donations for, number one, a terrific prize, and number 2, for monies to help the Mental Health Association at the same time. I think that's one of the fun parts of the event, as well as, of course, the interaction with the people and the other things that we do, the silent auction and the raffles. Both of those are fun as well. So I think overall the whole night is a good time. It really is.
I think so too. And, every year when these honorees get nominated, I think, golly, there's so many people out there that are doing good things, that are involved in the community, and they really, they connect with us. A lot of those people that have been in the event in that way, they continue. If we call on them to find out if they can help us in some way, they're there. They want to continue to be involved with us because they've seen, some of the people we've helped and how things are going. So yeah, I agree. It is. There's a lot of energy in the room. So
Yeah.
fingers crossed that we'll be able to have those 300 to 400 of our friends at the Civic Center again come July. So very good. So Liz, anything else that you have going on right now that you want to tell us about?
Well, with COVID, I've been basically working from home because our owner, my boss, his thing was he wants us healthy so that when it opens back up to where we can get into places, we're able to get there and we're not home sick and having to take care of ourselves. So that was one of the biggest things, staying home. But come Monday, we're going back out. We're getting back out in the field. It's going to be interesting because we don't know. There's a lot of unknowns, but we also know there's a lot of opportunities. There's people that we need to talk to and make aware of, that we are here available. And one thing I failed to mention, and I forget this a lot of times about us, is Solace Hospice also offers pediatric palliative care, which there's only one other one on the coast that I know that does that, which is basically pediatric hospice, but the kids are still able to get treatment while being in care. So that's another service that we offer that's very, like I said, it's very limited as to who can do it and who will do it because it is a whole different avenue. Taking care of a terminally ill patient, maybe even 29 years old with cancer, is so different than taking care of a 2-year-old patient that whose life is very limited as well. So both sides of that is difficult, but that makes it even more so. Like I said, I forget that one a lot of times, so I did want to mention that while it was in my head.
I'm glad you did. Gosh, because I wouldn't have realized that. And all these thoughts were going through my head as you were thinking, as you were saying that is, golly, how do you're caring for that child, or that adult as well. But like you said, you have to work with the caregiver too to help them to be able to cope with everything. And I can imagine how much of a relief it is to have somebody to help.
Yeah, absolutely.
Goodness. Well, Liz, gosh, this has been such great information. Thank you so much for clearing that up, as the difference in what hospice actually is. And excited to hear about all the other things that you're involved with. And we'll be coming back together to let people know what's going on with Don't Worry, Be Happy soon.
I know.